I'm in Alex's lounge, so I've just got Alex behind me with his torch.
Oh, well, there we go. Well, that's the perfect backdrop. That's the perfect.
Right,
Okay,
so
brilliant.
just got a few questions that we thought we'd
Yep.
put to you, if that's okay.
Yeah.
So the first one, obviously it's been a really hard year for Believe and Achieve. And obviously events, fundraising, lots of things have just played havoc with us. How has it made an impact on Meningitis now?
Yeah, so Alison, I think I'd have to agree, really. It's been a really, really challenging year, hasn't it? You say, it's not just charities like the Believe and Achieve Trust and Meningitis Now. I mean, it's businesses and charities up and down across the country. We like you, I think, thrive on face-to-face contacts, whether that's through the support events we offer for families and others affected by meningitis, or whether it's the fundraising events such as the marathons that people run for us, and bake sales and things like this, and pub quizzes. So the moment all of that has to stop, which of course is what happened under lockdown and is continuing now, then it's just such a shame. I mean, it's all of those meetings, they're the lifeblood of charities, aren't they? The support we offer people. That's what we're all about. But it also has a significant financial effect as well. So we've also had to, adjust the charity. Our income has, we were worried at one stage it was going to drop below 50% of what we were expecting for this financial year. It might not be quite that bad, but it is very, very significantly down. Therefore, whilst we've tried really hard to protect all the services and activities we undertake, so we still have research projects, we still raise awareness of meningitis, and we still support families. But we've had to take out over £1 million worth of costs through a restructure and through a reduction in our activities. So it's been a really, a difficult year for us now.
Yeah, definitely. Yeah, I agree.
I think we felt that on the smaller sort of scale as well, haven't we?
Yeah.
Like, obviously, I can imagine it being quite big on like charities like Meningitis Now, the bigger ones. But then, for us, we don't, not that we don't raise that much, that we don't raise as much money as yourselves. But then, like even like just coming up with little fundraisers, it's like how can you do that? And like Al said, like sometimes it's a bit, well, should we still be asking for money when you know how much people are struggling? But then at the same time, them people are struggling, but also we're there to help people that are struggling. So you got to target different people and sort of get people. And also, I think, like you're saying about the events, like when you come face to face, it's more of the fact of getting that community together and actually showing people what we do. And it's so hard to do that when nothing's really allowed to happen.
Yeah, I couldn't agree more. And I think you're right, actually. It doesn't matter whether you're big or small. I mean, proportionately, it feels the same. If you're having to think about whether you can retain staff, I mean, actually letting one member of staff go is awful, as is letting more. So I completely agree. I mean, but we're all in the same boat. I mean, that is one thing about the pandemic. It's everyone is touched by this in one way or another. And I think, the other thing is that, it is a bit of a cliche to say that when you're facing adversity, that's when you really have to sort of dig deep and that may mean sort of doing things differently or being innovative. But, actually that is what we do. We respond and we do things differently. And I'm quite, pleased with some of the steps that Meningitis Now has taken over the year to make sure we are still able to support families. So we had a scheme called the Young Futures Fund, where we were making financial awards to families who were finding it difficult to support their children's educational and developmental and learning needs. And even though we were in a financially difficult position, we still managed to get awards, sorry, I should say, they're not rewards, awards out to families to enable them to get, IT equipment or, homeschooling equipment or, the sensory toys and things to enable people to carry on at home. So it's not all bad. But, Alison, you and I our two charities would have had a very different year last year had it not been for the pandemic.
Yeah, definitely. Yeah, I mean, I think like yourself, it means an awful lot to us when we're able to give out a grant normally, but giving out a grant that we're able to do in this situation actually pulls even more on your heartstring, because you just think it's amazing that we can still do that, and that, we are still there to support people, and that means the world, doesn't it, really? I think. Yeah.
Oh yeah. And that's the thing, we've all just got to pull together, and you look around you and you see people who've lost loved one, and Alison, in terms of, well, either families experience or the families of people you support in Manchester, but of course, death from an infectious disease is what we deal with, and of course, so suddenly to have this on a mass scale, it was quite sort of traumatizing for some of the families we support. It suddenly brings back all these terrible memories, and on the one hand, that sometimes means people have got the strength and resilience to deal with, but on the other hand, it's it knocks people for six. Who'd have thought this would ever happen on this kind of scale? Also, I mean, Alison, again, you know a good deal about meningitis, through your work and through your family's experience, but of course, you know about vaccines, you know about infectious disease, but actually this is totally different. So again, I think we found that quite difficult. People come to us and say, well, what's going on with this and what's going on with that, and actually we're learning as much as anyone else how you respond to COVID-19.
Yeah, definitely. Do you think now, though, that the world, quite rightly, is looking now for symptoms of COVID? And I know one of my great worries is that meningitis symptoms are falling down yet again. I feel like I spend so much of my time trying to get people aware of the symptoms, but now I'm scared that those symptoms are going to be lost, and they're not as important to people as the COVID situation. I don't know if you feel the same about that.
Yeah, I think your concern is well founded, but I'm fairly optimistic that we can still cut through with the awareness messaging. I mean, our student campaign last autumn ran with the sort of headline, don't assume it's COVID, because we were concerned that people with those meningitis symptoms, the flu-like symptoms that come in the early stages, could just be mistaken for COVID. And in the worst case, you could imagine people self-isolating, which of course is the worst possible thing you could do should it be something like meningococcal disease or another kind of meningitis. So we ran a campaign on that basis, and we actually had a very successful media campaign, I think, precisely because the media outlets that might support this were quite sympathetic to our concerns. But I think the answer is we've just got to keep plugging away. I mean, I'm sure we'll come onto it in a moment, but the work that you do and that we do with public health authorities is just as important as it was before. I think they are committed to meningitis. We get some very positive signals in terms of the conversations we have with public health experts. But that doesn't alter the fact that they are just extremely busy and distracted, responding to the COVID health crisis. Now, of course, that mass rollout of vaccines.
Because I think that shown when, I think it was the CEO wrote a piece on your website about, it was like the highest number of, it was the least amount of cases ever. On record, and I think that's frightening, because you'd expect it to be the same or a little bit higher.
So I think the cases of meningitis, if COVID has a silver lining, if that's the right phrase, it is that the social distancing measures that we've all had to live with have reduced the transmission of the bacteria that can cause meningitis, and that has meant that we've had the lowest number of meningitis cases, meningococcal cases, at least, in this country ever. And the hope is that some of that will continue, partly because we're all still socially distanced, but also, you know, having dampened down the level of transmission, you know, that may well persist for a little while. So, you know, that's great news, but then it plays into the conversation we were just having, awareness raising, because we don't want people thinking that meningitis has gone away, because it really hasn't. You know, we've been looking, you know, working with a family, an adult meningococcal case that happened on New Year's Day. You know, I mean, it never stops, does it? And we know from the work we do, and you know, it doesn't discriminate on holidays. It doesn't discriminate rich or poor. You know where you live, north, south, east, west. You know, it's still there. We still need to be mindful and aware of those signs and symptoms, and we just got to keep plugging away.
Yeah. I know just before, obviously, the start of the lockdown, we were really excited that we were getting together to do some work on our students going back in university with the Greater Manchester Partnership. I honestly believe that no matter what will happen, we will get to do that. I think it's a massive ordeal for us. I think it's something that is needed. And I don't know about yourself, but I was devastated when obviously this sort of had to just be put on the back burner, and students did go back to university and they did go into the halls of residence, and unfortunately they weren't even able to go home for a while, which was even more worrying, because they were stuck in still not been able to get that meningitis awareness out there. Really hope that eventually we can get back and work on that. Definitely.
I'd just completely agree with everything you've said. I think the kind of work we were proposing, you know, with you in Manchester, working with the universities, working with the public health authorities, is really the future, really, isn't it? I mean, we, especially now that we've all got more limited resources and we're all under that much more pressure. So, you know, coming together, working together, will just mean that we can, you know, surely we can achieve more together, because you know, that might mean that you know, those of us on the charitable side for whom we have less money to spend, well, then we can make better use of other people's resources. You know, we've got some of the expertise, you know, we've got the volunteers, you know, who can really make a difference. And so I absolutely believe that all those same principles we were talking about at the launch of the Greater Manchester Meningitis Aware Partnership, you know, they absolutely still stand. But we, you know, frustratingly, I think we just have to be patient with our colleagues in the NHS and public health and universities, that, you know, they are dealing with really, really challenging circumstances right now. And but, you know, what's reassuring now, Alison, I mean, we you know, I've been talking to public health you know, managers and expert specialists in London, and of course, you know, they still, you know, they just reporting about what they want to do, they still want to do meningitis awareness. You know, they haven't forgotten. It's just to get it done.
Definitely.
The same,
which is fantastic. And I know for us as a charity, we are so honoured that we can work alongside meningitis now, and support the work that you're doing with all your knowledge and professionals bodies behind you, that we can support the work that you do, because obviously, you know, as you know, meningitis now is a massive thing for me, and helped my family through terrible times, and we want to be able to do that and work alongside you to support other families, which is why we work together with you with, if we've got any families in our area that have been touched by meningitis and need a grant, then we are able to put some of our funds towards your funds, because like you say, we all want the same thing at the end of the day, and it's about sharing resources and helping both charities to go as far and wide as we possibly can. Don't we? So thank you so much, Tom, for that. That's fantastic that we can just catch up and let our supporters know the work that we're doing with you, and that, you know, just letting you know we're really grateful for you allowing us to be part of such a fantastic organisation. So thank you very much for that.
Well, thank you, and thank you for those kind words. I mean, you know, you know, it's a privilege to work with you guys. I mean, you know, and Alex has played such an important role in our organisation, you know, many years ago, and you know, and it's important that we keep that spirit.
Yeah, definitely.
Spirit alive, isn't it, Alison? And so it's a, you know, it's a real privilege to be able to do that. And thank you for your questions today, of course, and Niall.
Thank you so much. That's great.